Hi there, you're welcome to Demi RX Care channel, where we talk about medications and how to use them properly. My name is Abidemi Adamson, and you're welcome to our channel. All right,
so our medication for today is amoxicillin. So amoxicillin is an antibiotic that's used most especially in our young children in order to fight bacterial infection. All right, so amoxicillin comes in different dosage strengths such as 250 milligram, 500 milligram, 875 milligram. All right, and with amoxicillin, it also comes in a suspension as well, which can be used in younger patients. Amoxicillin is used in helping to fight bacteria such as E. coli, Staphylococcus, Streptococcus, as well as Haemophilus influenza. All right, so it's used for various treatments such as strep throat. It's used as well for skin and other skin infection. It's also used for stomach infection as well as sinusitis or gonorrhea, as well as an ear, nose, or throat infection. All right. In patients, we usually use this medication every 8 hours or every 12 hours, depending on what the medication is meant to treat. Some adverse effects of amoxicillin include nausea and vomiting, which is very common in our young patients as well, because these patients, when they're not feeling so great, they tend to feel nauseous, which can also not help in helping keep the medication in. So usually the patient may have symptoms of nausea and vomiting already before starting the medication. And also taking this medication can also worsen that, and they're not able to use the medication as appropriately as they're supposed to. All right. And patient may also have diarrhea, which is also a common side effect of amoxicillin. If this diarrhea remain consistent or persistent, then you want to make sure you're reaching out to your doctor and seeing if they can change it to another antibiotic. All right. This medication can also cause a severe reaction such as hives. It's also called an anaphylactic reaction, where the patient's throat start closing up, their mouth gets swollen, or their face gets swollen, and usually you want to dial 911 or call for an emergency help because they might be having a severe reaction to this medication. In such instance, they would not have the patient using that medication ever again, because it will be noted on their medication history as a severe allergic reaction. All right. Another common side effect is itching as well as rash. Usually the rash goes away after a while of taking the medication, or if the rash becomes severe, then you want to reach out to the doctor and have them stop this medication, as this might also be an allergic reaction to the antibiotics, which is amoxicillin. All right, so what are some tips that you want to know while taking amoxicillin? So this medication is preferably taken on an empty stomach. So you want to make sure you're taking it 1 hour before your meals or 2 hours after your meals. And usually you want to take this with a full cup of water. All right. And also with this medication, you want to make sure you're taking it at even intervals. So let's say if you're taking it every 12 hours, you want to take it maybe 8 a.m. in the morning and take it at 8 p.m. at nighttime. That way you're able to keep the dose and time intact, so you won't be able to miss a dose. All right. Usually with antibiotic, the number one tip is making sure that you're completing the whole dose as it was prescribed. So if it's prescribed for 10 days, make sure you take it for the complete 10 days, even if you feel much better in between those number of days. All right. Another tip is that if it is given to you as a suspension, you want to make sure you keep the suspension refrigerated and make sure that you're discarding that suspension after about 14 days. Usually the patient will have to keep the suspension, take it, and make sure that you're shaking that suspension well before using it. Also, like I said earlier, a common side effect is diarrhea, and if this becomes persistent again, that may seem that the medication is not working the way it's supposed to, and the patient might have to report to the doctor and have the doctor change that antibiotic to another antibiotic. Also, this medication is safe in pregnant patients, and also the medication can decrease the effect of birth control in patients who are taking birth control. All right, so if you are taking birth control and you're prescribed this medication, you want to make sure that you're using an extra contraceptive while you're on this medication in order to avoid being pregnant while taking this medication. Also, in our patients that have a severe penicillin allergy, this medication should not be used in this patient because it can cause the severe allergic reaction, as this amoxicillin is in class with penicillin. All right, I hope this was able to help you all in choosing the right antibiotic and making sure you're following the tips regarding this medication. Make sure you check out our website at www.demyrxcare.com if you have any question for a healthcare professional, and we'll be more than happy to answer any question and give you a recommendation regarding your medications. All right, thank you and bye for now.